been interesting to watch how Aspen has taken what was, a once in a generation pandemic and turned it into a conversation around the interface between the public health sector and the healthcare sector. Our panel really focused on where the lines are and how important it is that we create a seamless back and forth between those lines. If we're doing it right, people don't really appreciate what the difference is between what happens in public health, sort of in the public sector, and what happens in healthcare, which is, we think of as the private sector, hospitals and doctors' offices. Some of the concrete examples, are in infectious diseases. We talked about measles and we talked about syphilis. We talk about how it's a diagnosis that you make for an individual, but then it tracks into the community because it's an infectious disease. And so healthcare might make the diagnosis. Public health might do the contact tracing and help to educate the community, which then, of course, informs healthcare as we start to look more and more for the diseases that are coming our way. These conversations it's essential that we have a pathway of communication back and forth between public sector, educating the communities about what they needed to do, and private sector, where we're making the diagnoses, and in serious illness, treating patients with the diseases.